everyone, my name is ELLEAN from this ENAD, BSN1A, and for today I'm going to demonstrate on how to conduct parenteral administration. Under the parenteral administration, we're going to perform intradermal injection and intramuscular injection. So the first thing that we had to demonstrate is the intradermal, a shallow or superficial injection of a substance into the dermis, which located between the epidermis and the hypodermis. So I am already done to perform hand hygiene and now privacy for the patient. So now secured. As you can see, I am wearing these gloves for the safety of myself and for my patient. So let me introduce first all the equipment that we needed to the procedure. First we have is the syringe. I have tuberculin syringe, which is ideal for the skin. That's and the 5cc syringe with a good 23 needles for the intramuscular injection. Draw to the medication from the vial, and most have is ampicillin 350 with eternal water already. So cotton balls is with the alcohol, and other one is just dry cotton balls, hypodermic tray. So this is the hypodermic tray, and the last I have waste is receptacle where I am going to dispose to use the needle. This is the needle. So all of the equipment is now prepared. Now check the doctor's order to the party with medication administration record. So this is. So this is done to identify what kind of drug is to be given. So to prepare the medication in an intradermal injection, first we need to get the tuberculin syringe open to the sterile package. So I am going to open this. And the spiral needle, so this. And to connect the tuberculin syringe to the aspirating needle to secure the insecure connection of the needle. So okay, set aside first to the open the medication vial, open the vial. So I will set aside this to this area. So clean the surface to the rubber. So I will clean this. Using cotton ball stuck in the alcohol. So now I take the syringe and cut the syringe to the jaw some. So I will open this and I will clean this. So now take the syringe and cuff the syringe and now draw to the air in the syringe. After that, inject the air into the vial. Then invert the vial and draw to the expected amount of medication needed. To top the barrel to remove the air bubble. So remove the inspiration needles into the replace in with a new one. discard the inspirating needle used into the waste receptacle. So I will put this tray into the patient. So write the medication ticket. Medication ticket to the name, the drug, to dosage, so that we want to forget that medication we administer. Now we're going to perform the injection, the medication vial, intradermal site. We're going to use this one, the vegetable, for the administrating the medicine. So let's assume that this is a intradermal site of the patient. So first check the medication and as the patient chart. So let's compare the vial to patient chart. So this is the medication tray of the patient. So now arrange the medication part on a hypodermic tray. So I will arrange. So now the arrange. Now choose the injection site, free of lesion and discoloration. So now I will check this. So I will use this cotton to clean this vegetable. So I will put this into the receptacle. So now choose the injection site, reveal into the discoloration. Now use antiseptal swab to clean the site. So we're done. So now remove the cap and hold the syringe between the two thumb and the fourth finger to the needle pointing up. So now I will put this. So check the skin tone. So I will check this. So pull the needle very close to the patient's skin. Insert the slowly at the 5 to 15 degree angle. So I will inject this, slowly inject the medication. Let us inject this slowly. And now I will put this cotton, then I will and now I will withdraw the needle at the same angle to minimize the tissue damage and discomfort. So I will put this into with this. Now I will going to encircle the site of injection. Now we are done with the interval dermal. So we are done to demonstrate intradermal injection, and for this time we are going to demonstrate the intramuscular injection. So intramuscular injection is the introduction of medications deep into the muscle tissue where a large network of blood vessels can absorb it readily and quickly. So to prepare the medication and on intramuscular injection, first we need to get the 23 gauge syringe open the sterile package. So I will open this. So it is done. So open the aspirating needles. So I'm done open. So now I will connect the 23 sage cereal to the aspirating needle. So I will connect this. So, okay, set aside the first, then open the medication vial. I will set aside this into this area. So now I will open this vial. And to clean the surface of the rubber, I will using the cotton ball, soap, and the alcohol. I will pick this one, then I will clean it. Now take the syringe and cuff the syringe and draw solved air inside the syringe. Then after that, inject the air into the vial. Then insert the vial and draw the exact amount of medication needed. So tap the barrel to remove air bubble. So now remove the unspare needle and replace it with a new one. To place so now I will place it in the hypodermic tray. So this. And aspiration needle is into this receptacle. So I will throw this into the bin. Then write the medication ticket, the name of the drug. So this. If this dosage 90 that we forget that medication we administered. So I will check. So now we're going to perform injectional the medicine via intramuscular site, and we're going to use this green, and I will put this to the patient. And now we are going to use this green vegetable for the administering the medicine. So let's assume that this is a intramuscular site of the patient. First, check the medication order on the patient chart. So I will compare it to the patient chart. So this is the patient chart. So now I will clean this vegetable and I will use this cotton, the dry cotton, the one dry cotton, and clean this surface. And I will throw to the bin. So that's why it's clean. So now arrange the medication and the hyper tray. So now I will arrange, this is the tray. Now choose the injection site free of lesions and discoloration. So this. And now remove the cap. This is the cap and I will remove this. And next we're going to take a non-dominant hand and we are just going to the side. This is my hand and I will going to set aside this hand and we're just going to the side where inject side of going to be and we're just going to put little bit pressure and we're just going to pull the skin to the side. So I will get the pressure of this. Then take our dominant hand with the injection to the needle and we're going to like this, going to pull this. With shooting a dart and 90 angle, you do this pain so we are too steady. Depress blogger and instill fluid and slowly over 10 seconds. Once installed, let the fluid and down to the muscle. And next, take it all the same angle we had to insert it. So now I will put this and now I will put this cotton to this area. And I will throw this cotton to the bin. I will throw this to this side. And now I will encircle site of injection. That's all for the parental administration using the intradermal and intramuscular. So that's it for my presentation.